All right, everybody. Hello. It is Wednesday, April 14th. Happy Ramadan to all who celebrate. And it is also Wednesday, and you can sit with us. So please welcome to our live session today. Let's get started. And so I'll be going over a quick startup presentation to welcome you all and introduce you to our program and opportunities if you have previously attended our shadowing session. So pre-health shadowing is a student-led, minority-led, women-led nonprofit dedicated to helping prospective healthcare professionals gain access to educational resources, no matter their demographic status, abilities, or location. My name is Ni, and I am going to be the co-host today at Pre-Health Shadowing. Thank you all so much for attending today. Let's get started. And so just a little PSA, as usual, we do have closed captioning for all of our sessions to accommodate all of our students. This setting is available on the bottom of your Zoom screen. And if you need assistance enabling the transcript, please direct message one of our team members. We are always looking for ways to be more inclusive and ensure our sessions are accessible to everybody. So please, if you have recommendations for how we can improve, you can email us at info@prehealthshadowing.com. And so moving on, so since this is an international program, we want to know, where are you Zooming from today? Drop it in the chat. Cool, I see my fellow Chicagoans. It's so exciting. I give you all virtual hugs. Thank you all so much for coming in today. And so continuing on, if you want to stay in the loop, we are trendy and up to date. So we are on social media. Follow us on social media. We are active on Instagram and TikTok, or you can sign up for our email list on our website to never ever miss a session. We're not taking attendance, but you don't want to miss one. We have some wonderful opportunities for you all as benefits for being a part of our program. And so we have partnered with Kaplan, as you can see, to get you guys a 10% off discount code that can be used on all Kaplan products, as well as free resources like study guides to help prepare you for standardized tests like the MCAT, NCLEX, or PCAT. If you fill out our short survey in the chat, thank you, Katie, you will get hooked up with this. So it's a great resource that I recommend checking out. And then towards the bottom, you can see Neolith. We would like to draw your attention to that. Neolith is an online, amazing mental health platform for students. College and young adulthood is stressful enough as it is in non-pandemic times. I understand. For pre-health professionals especially, we know the path is not easy. That's why we have partnered with Neolith to give you guys free access to their services if you use the link in the chat or enter the code PREHEALTH, no dash in between, when signing up. Next, Mask for Mask is an amazing women-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic, those in the homeless community, healthcare workers without proper PPE, and others who are just struggling to stay safe. With our discount code PHS15, you can get 15% off of your order. If you buy through this method, pre-health shadowing will also get 10% off the proceeds, which is amazing because we are a nonprofit that runs solely off of the support and work of our students, just like myself. And so if you want to play a bigger part in supporting PHS, moving on, we would love for you to join our network of student volunteers and team members. You can apply to be a part of our administrative team and lead students in various projects, initiatives with professional outreach, grant writing, and so much more. We understand that as a pre-health student, you may not have the time, so we also offer the opportunity to volunteer asynchronously with tasks that can be done on your own time. We would love to have you be a part of this program and contribute your own unique perspective. Next, if you are a very young high school student and you want to get involved, we are starting a program called HTP, or as you guessed it, high school training for PHS, which allows you to connect with college pre-health programs, get involved in fundraising for PHS, organize resources for other high school students, and just you're just interested in medicine throughout pre-health shadowing, we want to recognize the hard work of all of our students in the program. So if you're interested in getting published, like get your name out there, like Mark Brown or like other famous authors, you could submit essays, reflections, research papers to our editor-in-chief through the link dropped in the chat to have your work on our website. This will look great on your CVs, applications, resumes, etc. So take advantage of this. Next, part of our mission at PHS is to promote diversity. And so in order to do this, we have launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. Some of these upcoming events include a COVID-19 roundtable, an international student forum, and so we're also taking requests. And so if you have a mentor, professor, or professional who has inspired you and could think to contribute to these conversations, nominate them today using the link in the chat. Next, if you can, we humbly ask that you donate to our program. As I have said, pre-health shadowing is completely student run, and we are working around the clock to keep this free and accessible to every single person here. Unfortunately, Zoom and our website are not at all free, so any contribution you could give would be greatly appreciated. If you are not financially able, you could also send this link to someone you think can in order to continue to support those who cannot afford similar opportunities. Throughout the session today, we encourage you to drop any questions, comments, any thoughts that you have for the speaker in the chat. Our team members will be making note of these to be asked in the latter half of the session in the Q&A. Take good notes as our professional is going over their presentation, as there will be the chance to take a 10-question post-shadowing assessment to verify your virtual shadowing hours with a shiny, beautiful certificate. More information will be available on this at the end of the session, so stay tuned. Last but not least, we request that you turn your cameras on. This is by no means an obligation, as we are respectful of different circumstances, but it does help us feel closer together in a time when socially distancing is mandatory. And plus, I like to see everybody's faces.
Okay. Okay, let's see here. I'm hoping everyone can see me and hear me, and I am very excited for this presentation. I was talking to the staff earlier, and I was just saying how exciting it is that this is available to everyone. And so you can really get the chance to experience this shadowing experience of some professional that you might not be in your community. So I'm Dr. Allegra Burgher. I'm an optometrist, and today I will be giving a presentation about pediatric optometry. So what is optometry? Optometrists are doctors who examine, diagnose, treat, and manage different components of the ocular system. So that includes any diseases, injuries to the eyes, disorders of the visual systems, or the associated structures. And we also identify and refer and coordinate and collaborate with other professionals with systemic conditions that sometimes we are the first to diagnose. Optometrists are responsible for prescribing spectacle and contact lenses, different medications for infection, control, dry eye, different medications there. Low vision for patients who have a ocular disease that has limited their visual field or their ability to see. This picture right here is of a gentleman using a CCTV to read his music, and this is something that's fairly common in our older population, but we also see this with children who have specific diseases. We also prescribe devices to aid in visual impairment or to enhance your visual system. We also prescribe rehabilitation, whether that's referring to another practitioner in a different specialty or by providing that rehabilitation ourselves with vision therapy. Optometrists are responsible for performing exams and, in some states, minor surgical procedures. We counsel our patients when we have to refer them to a specialist, or we'll work with a specialist to manage a case. And we also counsel for surgical opportunities for the patients, whether that's to prevent loss of vision, prevent loss of life, or to enhance their visual needs. We do recommend lenses and devices and any sort of ergonomical changes to improve their visual experience. And we also are responsible for educating the public and the community about their health and their eyes and being available to be a resource within our community. And so that, in a nutshell, is what optometry is and what we do. So this presentation, I'm going to dive into what I specifically do. But before we do that, I would like to share with you all this wonderful video from the National Institute of Health about how eyes and the brain works. And I'm an optometrist, not a graphic design person, so I thought that this video did it the best. So tune in for this video. It's meant for kids, but I think it's great. Even as an optometrist, I thought, wow, they really got it. So let's take a watch of this video real quickly, and then we'll get to it.
Your eyes allow you to see the world around you, but have you ever wondered how they work? First, it's important to know that vision depends on your brain as much as on your eyes. Your eye's main job is to detect patterns of light. Then, they work with your brain to turn those patterns into images. Let's take a closer look. Light rays bounce off an object you are looking at. Let's say the object is a dog. The light reflects off the dog to your eye. Then, the light enters through the outer part of your eye, called the cornea. The cornea is clear like a window. It helps your eye focus the light to make things look sharp and clear. Next, the light rays pass through an opening called the pupil. The pupil is the dark round circle in the colored part of your eye. The colored part is called the iris. It controls how wide the pupil is and how much light can pass into your eye. In bright light, the iris narrows the pupil, reducing the amount of light that enters the eye. In dim light, the iris widens the pupil to let in more light. All of this happens automatically. Behind the iris is the lens of the eye. It helps focus the light coming into your eye so you can see things clearly. The lens flattens so you can see things that are far away, and bends so you can see things up close. When the lens, cornea, and pupil are all working together properly, they will focus light on the back of the eye. That's important because lining the back of the eye is the retina. There are about 130 million tiny cells in the retina that are sensitive to light. When these cells detect light, they turn it into electrical signals. Those signals eventually make their way through the optic nerve, which is like a cable connecting the retina to the brain. The retina helps create a rough image, but it sees the world upside down. It's your brain that turns what you see right side up. Also, when you look at an object, each eye gets a slightly different view of the world. The brain combines those views and makes them into one picture. The brain also adds a lot of details to your vision, so that you can see complex shapes, movement, depth, and a rainbow of colors. And of course, the brain connects your sense of sight to things you already know, so that when you see a dog, you recognize it as a dog, and not a cat or a monkey. And that's how you're able to see. To learn more about how your eyes work, visit nei.nih.gov/kids.
Okay, so now that you have an idea of how the eyes work, let's look at what it takes to become an eye doctor or an optometrist. So first, you need a bachelor degree, and that may take you 3 to 4 years. And then you can go on to optometry school, which is a 4-year graduate school. And then there is an optional residency for specialization, and those residencies are either 1 to 2 years. Now, when it comes to different degrees, there are some exceptions to if you need a degree before entering optometry school. So it's specific to each school. With the optometry schools, there are currently 23 accredited optometry schools in the United States, including one in Puerto Rico. And the residencies, there are 260 optometric residency programs. And that's where you really specialize. And what you specialize in depends on what you're interested on. So we have different categories of optometry with emphasis areas that interested optometrists can go into. So we have primary care, pediatric optometry, cornea and contact lenses, vision rehabilitation, and ocular disease. And within those categories, we can have a focus within a community or within specific diseases themselves. There's an entire specialty just for the retina, for example. And there's lots of different ways that you can do it. But all in all, the optometrist is someone who helps people manage their health conditions, improve their performance in their classroom or on the playing field. They are able to help regain the ability to drive or accomplish other activities. They can see the world more clearly with new contact lens designs. And every single patient encounter, your goal is to improve the quality of your patient's life. And so this was a quote that I pulled from my alma mater of Michigan College of Optometry. And I thought it was very broad, yet right on. Okay, so who am I? I got my Bachelor of Science in Vision Science from F.A.A.O State University. This is from a small town in Michigan. And then I received my Doctor of Optometry, which is OD, from the Michigan College of Optometry at F.A.A.O State University. And I did my residency in Pediatric Optometry and Vision Therapy at the Southern California College of Optometry at Marshall B. Ketchum University. So this was Michigan, where I started at F.A.A.O State. And I went to Michigan College of Optometry for my degree. And then I went out to California, and that's where I stayed. So I practice in Southern California in the Orange County area. And my official title is Assistant Professor at SCCO, which is Southern California College of Optometry. It's the oldest optometry school in the country. So I practice in 3 separate clinics. I practice in a vision therapy clinic. I also practice in the pediatric vision clinic, where I just do pediatric eye exams. And I also run a vision clinic in a community center through the Boys and Girls Clubs of Garden Grove. And so that's a little practice that I do as part of my facultyship here at SCCO. I'm responsible for teaching in both the clinic and in the labs for optometry students, and I work with 1st through 4th year students. I'm also involved in research, and I do both national and international research studies, and I do that through the clinic here at the school. So when it comes to picking out what you want to do with your life, it really isn't about setting a goal or a destination. It's really about how do you want to spend your day. And I started to get a sense of how I wanted to spend my day when I was younger, and I just loved optical illusions. I don't wear glasses. I don't wear contact lenses. I just like optical illusions. I thought that they were super cool, and I loved how your brain can trick you. And I thought that it was just so fun to look up. So back in the days of dial-up internet, I would spend all that bandwidth just Googling optical illusions. And so I didn't think much of it. But then when I was young, I think I was about 6 years old, I watched this movie called The Sixth Day, and it's by Arnold Schwarzenegger. And this is a movie about clones. It has nothing to do with eyes, but there's a scene in this movie where Arnold is trying to find out if he is a clone. And to do that, you look in the mirror and you pull down your eyelid, and if there's a dot, then you are, or something like that. Anyway, not that great of a movie, except if it has personal meaning to you. But if you want to watch it, you can. Anyway, so this movie, it really got to me at apparently a very impactful moment in my life, because I saw this movie and I thought, oh my goodness, could I be a clone? And so remember, I'm a little kid. So I go to the mirror and I pull down my eyelid and I look for this dot to see if I could possibly be a clone. And no, I'm not a clone, which is good. But I did notice that my eye looked super cool. And I thought, whoa, this is my iris? I've never looked at this before. And I just loved the colors. I loved the texture. I loved how the pupil got bigger and smaller. And that just got me interested in eyes. And by nature, I'm a fairly curious person. And I thought, well, why not learn more about it? And that's what got me tumbling on this journey to become an optometrist. And even today, I don't feel like I've met that finish line. I'm just always thinking, wow, how does this work? Or why does this person have this disease and how can I make them better? And so those are the questions that inspire me every day. So that's a little bit about me. But this is not about me so much as it is about your shadowing experience. So I would like to give this opportunity to demonstrate to you a few cases that I remember fondly that have happened in the past year or so. And these cases, I think, are a good way to highlight some areas of what I do. After I share with you these cases, I then will give you a snapshot of what my day-to-day life looks like of just one of my clinic days. And hopefully that will give you a good view of what a pediatric optometrist does. Now, keep in mind that optometry has all of these areas. And so if you're not interested in kids, but eyes are still exciting to you, then go shadow someone who's not maybe a pediatric optometrist, but maybe a geriatric specialist. So there's lots of different areas, but this is a flavor of the pediatric vision. So the first case I'll share with you, I've titled it Social Media Saves the Day. And this is a story of a patient. He was 2 months old and his parents came in to see me for a contact lens fitting for a 2-month-old baby. And I said, wow, how did this happen? And the parents said, well, we are part of a group on Facebook and a different set of parents on Facebook just posted a viral video. And it was about how their child had a white pupil when they took a photo of him with a flash on. And so here's a picture of a white pupil. And this is in a little kid. And the parents of that child, they took him to the doctor. And the doctor diagnosed him with retinoblastoma. This right here on the left is the picture of the retina of the back of a patient's left eye. This right here is a picture of a retina with a retinoblastoma, which is a malignant tumor that can be deadly. So to find this in an infant is quite serious and it could be life-threatening. So the parents took the child to the doctor diagnosed them with retinoblastoma, and they were able to remove the retinoblastoma and treat the child and save his life. And this was a viral video that my patient's parents saw, and they thought, oh my goodness, we better look at our son. So a little bit about retinoblastoma before I move on is that it is a malignant tumor in the back of the eye. And you can see it when you take a picture with flash, and you'll see a white pupil, and you can see another example of that down here. It can be in one eye or both eyes. It usually happens in young children because it can be fatal, as it may spread to the brain or the spinal cord. There's 11.8 cases per million live births, so it is fairly rare. The treatments include enucleation, which means removing the eye, doing laser treatment on the cancer, or doing chemotherapy. So this is something that we are always looking out for when we examine young children. Let's get back to my patient though. So my patient, when the parents took a photo of my patient, they noticed that, oh no, he also has a white pupil. Fearing the worst, they took the patient to their ophthalmologist, which is an eye surgeon, and they took him to the ophthalmologist and they found that he does not have retinoblastoma. He has a congenital cataract. A congenital cataract, it looks like a white pupil. It can be in one eye or both eyes. It is often in young children, which this is all sounding a lot like retinoblastoma right now. It can permanently impair vision if it's not removed. But this is a little bit more common than retinoblastoma in that there's about 3 to 4 cases per 10,000 live births. Treatments include removing the cataract lens, and then you can either put in a plastic lens in place of it, or you can use a contact lens over top of the eye. And the treatment is to improve the vision of the eye as the child develops. So let me give you a quick anatomy lesson. I know we already went through that video, but right here we have a cross section of the eye, and this is the lens, this big white oval in the middle. Now keep in mind that oval is normally crystal clear, and a cataract is when this crystal clear lens is actually cloudy. And if it's cloudy, think of it like a dirty window. A clear image cannot make it through all the way back to the macula, which is the spot on the retina where we have our most sensitive vision. So if a baby doesn't have this lens clear, then the baby's brain will not receive a clear image, and then it won't be able to develop properly. And so when you are working with children, this lens is very small when you're born, and as you grow, the eye and the lens grows too. So that will make the treatment a little more challenging. So this next slide is a graphic image. Please be warned. If you want to look away, I'll let you know when it's over. So this is a picture of a cataract surgery. Down here we have an ophthalmologist doing surgery on a patient. You can see him looking through his microscope here, and he has his tools in his hand with his assistant on the side. And this is the view from what he's doing. So this is a patient where the patient is looking straight and the patient is supine, and the doctor is looking right over top of the eye. And so the doctor goes in, and this red is called the red reflex. It's just the pupil is giant and we're shining light into that dark space. So you can see that in box C, the surgeon is breaking up the lens. It can be kind of hard. So the surgeon is going in, and it's like a jackhammer basically, but a miniature one, and it just breaks up the lens. And then he goes in with a little vacuum cleaner and sucks out all of the pieces. And then he leaves just this empty space, and there's a capsule in there. And so he leaves this empty space. And so it's at this point here at box G that the patient, if you're going to implant a replacement lens, then that's the next 2 steps. But if you're not going to implant a new lens, then this is where it ends. So here in H and I, the surgeon is implanting a new silicone plastic lens, and it's just a plastic lens of the correct power. Okay, if you looked away, you can look back. So now I have a child whose normal vision with the lens, where what happens is light comes into the eye, the lens helps refract the light to a perfect point to land on the back of the eye. And if you don't have this lens, then the light doesn't get condensed fast enough. So then you get this blurry image up here. You can see that the light comes in, there's no lens for that light to get condensed, and the light just continues all the way back behind the eye. So this is where I come in, and this is where I met the patient. So the patient had already gone to the surgeon, had the cataract removed, and then the surgeon referred the patient to me to say, okay, I got rid of the cataract lens. Now I need you to help him see well. And so he chose not to implant a lens, a plastic one, because if you do that as an infant, then as the eye grows, you'll have to replace that intraocular lens. So this surgeon opted to do a contact lens, which I would be responsible for fitting. Now, how do I find the contact lens power? I use a tool called a retinoscope, and the retinoscope is a tool that bounces light off of the back of the eye, and I use that in conjunction with lenses to determine what the power of the contact lens has to be in order for the patient to see well. And of course, because he's 2 months old, he doesn't really get much say in what is clearer for him. So if any of you wear glasses or contact lenses, you're probably used to seeing numbers such as 1.5 or 4 or 3 or numbers like that for a child. Well, this lens itself has a power of 15 plus however short the eye is. So for this child, the contact lens that I prescribed him was a plus 29 diopter lens. So it was a very highly powered lens, which is common for patients who are aphakic, which means that they had a cataract removed or a lens removed from their eyes. So I was going to fit this baby with a contact lens, and I had to special order it from a company. And the contact lens, you can do a soft lens that's really flexible and permeable, or you can do a hard lens. And different practitioners have different styles. My style is a softer lens. So this video is a little upsetting if you are queasy about eyes, so I'll just warn you here. But this is how you instill or apply a contact lens into a baby's eye. So let's start from the beginning here. Here we go. So this baby's eye. So you just roll the lens up like a little taco or a fan, and then you just slide it under that lid, and there we go. And to remove the lens, we use the lids as little extensions of our fingers. And this looks like it might hurt the baby, but it does not hurt the baby. This is not painful. And you can see the baby is fine at the end of it too. So that's how you insert and remove a contact lens. So the reason why this is important is because if we leave the eye, now this is a transverse section of the brain here, and you can see that we have some eyes right here, and then we have these radiations and these nerves that project backward from the eye. And so the optic nerve, it enters the eye, and then it takes all of the information that comes from the retina and it transmits it back into the occipital lobe in the visual cortex. So that information that gets transmitted, if it's not crystal clear, then the brain is unable to develop good vision. So let's say, for example, that this little 2-month-old baby didn't get the cataract surgery. Then this brain would not recognize that eye as a receptor organ for good, clear vision. It might only prefer the other eye instead. And we'll talk a little bit more about that condition later. But thankfully, we were able to fit this baby with a contact lens, and he's been able to develop his vision on track to serve a normal purpose with that eye. So that's been very exciting with him. Now, I would be remiss if I did not mention this program called Infancy. You are probably already getting a sense that if something isn't right with the eyes when the baby is young, it can affect them for the rest of their lives. And that's why there's this federal program called Infancy, where optometrists like myself give free eye exams to any baby, regardless of their insurance status or any problems. We will give a free eye exam to any baby from 6 to 12 months of age. And we do this to screen and treat and diagnose things like excessive tearing, red or encrusted eyelids, constant eye turning, extreme sensitivity to light, or the appearance of a white pupil. And we can look to find what that might be related to. So if you know someone who has an infant, or if you have one of your own, you can look up Infancy and find a provider near you. And this is just a public service that we do because we want to prevent these things before they become life-threatening or sight-threatening. So that was case number 1. The second case I'd like to talk to you all about, I've titled it Listening and Light. So what you see here is a four-octer, and when people think about the eye doctor or the optometrist, they often think of this test where we ask, what option is more clear, choice 1 or choice 2? And then the patient, of course, replies, choice 2 is more clear, doc. And you say, great, and then you move on with the test. Now that test is called a refraction. A refraction is a way to fine tune the prescription of someone's glasses so it's absolutely perfect for a patient. Now think about this for a moment. how do you think a baby would do this test? Or an adult who is unable to speak? Or maybe a rambunctious child who won't sit still? So those are the types of patients that we might not be able to do this test with. So then I was a little surprised when my patient, she was a 9-year-old female, came in and she sat very well and she was able to answer her questions. And she says, Dr. Burgher, I am afraid that I am losing the vision in my left eye. And I said, oh my goodness, tell me why you think this, what's going on? And she says, well, I sit for this test and I say, what's better, 1 or 2? And I say, this is better, but my vision is just so poor in my left eye and I'm afraid. And so I was a little nervous too. Now in children, lazy eye, what that is, it's when the development of the vision is poor in either one or both eyes due to a reason such as blocked vision, which we just covered when we talked about the cataract in the first case. Blurry vision, maybe they needed glasses and they never got the glasses. Or an eye turn, where the eye is physically turned and the brain just doesn't pick up the signal from that eye. If any of those things happen, then the patient or the child might not develop their vision appropriately. In a couple of studies from 2008 to 2009, it was estimated that about 2% of the population of children have amblyopia. And although that's a low number, that is a majority of what I do and what I practice. So let's get back to the case. So this girl, she tells me that her left eye is blurry and she's done the test. So I'm thinking, well, maybe this is amblyopia. And instead of doing that test, let me use my trusty retinoscope, which is my favorite tool of all time. Let me use my retinoscope to measure where that light is landing on your eye. And maybe I can give you a case 3 is called It Hurts to Read. So this case is a really good example of why I love my job as a pediatric optometrist. And this is something very specific to pediatric optometry. So this girl, she's 16 years old. She came in to see me because she went to her previous eye doctor, her general eye doctor, and she said, it hurts to read. And the eye doctor checked to see if she needed glasses. And he said, no, you're fine. You see 20/20 vision in each eye. There's no problem here. And the girl said, well, that doesn't make sense because it hurts to read. So then she was referred in to see me. And this is where my specialty really shines. So she is still in high school, but she wants to go to school to be a dentist. And she just cannot get through her reading materials or her study materials. So what I did is I performed an ocular motor, sensory motor exam. So sensory motor eye exam is not where I look to see if you need glasses, although I do check that, but I look at how your eyes work together. So one of the first things that I do is I measure your ocular motility, which is how your eyes move through space or jump from point to point. And I look to see, do you use your body to help move your vision, or can you do it just with your eyes? I also look at your accommodative system, which is your lens focusing system. And in the video earlier, they did talk about how your lens can move and focus. So when you look at something far away and then look up close, your eyes actually autofocus. And so I look to see if that autofocus is calibrated correctly. We also have something called your Convergence system. Your Convergence system is how your eyes move as a team. So that's when, if you look up close, you'll notice that your left eye turns in to the right toward your nose and your right eye turns left into your nose. And your eyes, when they turn together, they have to point at the same thing in order for you to see single and clear. And lastly, I look at what your sensory fusion status is. So once I determine that your eyes and the muscles around your eyes are healthy and the back of your eye is healthy, now I want to see if your brain is combining the images from each of your eyes correctly. So I have an exercise for you all to try on this slide to demonstrate what sensory fusion is. Here we have two squares, and what we have is in the middle of the square, these little pixels are offset by just the smallest amount. And so I'm going to demonstrate to you how your brain can actually compare, analyze, and create a new perceptual image for you to appreciate that depth. So what I'll have you do is make sure you're about 50 centimeters away from your screen. And I want you to cross your eyes really hard, like you're looking at the tip of your nose. And then try and move your attention to the background of your computer screen. And you'll either notice 4 squares or 3 squares. If you see 3 squares, look at the middle square right now. If you see 4 squares, then slowly uncross your eyes a little bit more until those 2 middle squares overlap and become 1. Once you have that middle square, you might notice that you see a box popping in or going away from you. That box is the perception from your brain where it analyzed and said, you know, these borders are different from my left eye and my right eye, so it must be deeper. And so that is what sensory fusion is. And so everyone can uncross their eyes, blink, 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 look away a little bit, relax those eyes. And so for those of you who didn't see it, these are where the boxes were, and they were displaced like that, and they looked 3-dimensional to you. Very cool. So here's another example with a little bit more detail. So again, we have 2 different images. Your left eye is going to look at one image while your right eye looks at the other, and your brain will combine it in your head. So go ahead, cross your eyes, find that middle image, and you will see in the foreground, we have that brush up there. You can see the tree is farther back, and you get this really nice sense of 3-dimensional space. Now, if you have uncorrected refractive error, if you're not wearing your glasses, if you have an eye turn, if you have several different things, then this might not work for you, and that's okay. But if you are able to do it, it's just a cool experiment to see how this works in your brain. Okay, you can uncross your eyes if you're still looking at that, and you can blink a couple of times and look far away to help reset your eyes. So after I did all of that testing on this girl, our 16-year-old female, I was able to diagnose her with a condition called convergence insufficiency. Convergence insufficiency is a very common binocular vision disorder, which is associated with a lot of symptoms like eye strain, headaches, blurry vision, double vision, sleepiness, difficulty concentrating, movement of words or print while you're reading, and loss of comprehension after short periods of reading or performing close activities. Now, if some of this sounds familiar to you, then it might be worth it to get checked out by an optometrist. Now, this quote comes from a study, one of the landmark studies of convergence insufficiency. And we'll talk about this study in a little bit. But imagine if you had these symptoms, what that might be like if you are trying to read all of the time and you just are unable to get there. So look right here how we see these words. They're not quite clear. They come in and out. They kind of move a little bit. So we have all of these little things going on that can complicate your reading comprehension. And this is the result of the eyes not being able to move inward toward your nose equally and together. So you have one eye pointing in one direction, another eye pointing elsewhere, and your brain is trying to combine those images. It's not that you have an eye turn, it's just that the eyes are not tracking with each other well. And so you can see how this could really impact a child's learning development. Even an adult can struggle with this. So this video, I really liked it and how it demonstrated what that symptomology could look like for a patient. And it was produced by F.A.A.O Vision Therapy. And this video, I just had to include it. This is a great practice too. So you can look that up later if you would like. Anyway, so convergence insufficiency, it affects about 5 to 15% of school-aged children. This is not just a childhood disorder. This also occurs in adults. The symptoms include sore eyes, headaches, blurry vision, double vision, loss of concentration, frequent need to reread things, difficulty remembering what was read, and it can be very stressful for someone, especially who wants to go on to dental school. The treatment we found from, well, I was not part of the study, but it was found by the researchers of that previous landmark study that vision therapy or prescribed activities to enhance your eye functionality is effective at reducing the symptoms and the signs of convergence insufficiency when compared to placebo, which means doing something but not actual treatment, but thinking it's real treatment, compared to home vision therapy, compared to a computer program. So they found that in office was more effective at reducing these signs and symptoms. So what is vision therapy? This is another part of what I do as a pediatric optometrist, is I improve the abilities and the control of a patient's eyes using a specified prescribed sequence of activities using prisms, lenses, filters, different computer programs, instruments, and most importantly, coaching. And this reduces the symptoms that you can see over here. So as you go through vision therapy, these symptoms go away. Vision therapy is important to make sure that it becomes a second nature skill. So you shouldn't have to think, move my eyes here, then move my eyes here, then do this. No, you need to focus on what it is that you're reading, not how to move your eyes. So vision therapy, we train you to move your eyes efficiently and effectively for comfortable binocular vision. And then we make it automatic so you don't have to think about it. And that's done with lots of training. So what we did with this patient is we signed her up for a vision therapy program and we started training her, and she's already reporting reduced symptoms, and she's still in the program, and she's looking like she'll be graduating fairly soon with outstanding marks. So that was my case 3. Okay, so now that I've highlighted those cases for you, I now would like to show you what an average day looks like for me. So keep in mind that I am in an academic institution, so I am overseeing students, and then I come in too. So a lot of optometrists might see 20 to 30 patients a day. I usually see about 8 patients a day because it is a teaching institution and our exams are quite long because we do most of the tests available to us. So this was my literal schedule that I pulled from a couple of weeks ago, and I thought that it was just a great outline of all the different things that can walk in my door. So my first patient of the morning was a 3-year-old male, and his parent brought him in because he was tilting his head to look at things. And he would tilt it this way sometimes and the other time that way. And he just never would look at you straight on. Well, I was so happy that this patient's mom brought him in because that can be a sign of some serious eye conditions. So I was very happy that she came in. I did my full testing on this child and I found that he had nothing wrong with his eyes. So it was just a little thing that he was doing. And I was happy to tell him to come back in 1 year or sooner if anything came up, but there was no problem with his eyes. And so that was a great way to start the day. The next patient I saw was a 9-year-old male, and he came in because he has type 1 diabetes. So if you have diabetes, whether it's type 1 or type 2, it is a disease of your small and medium blood vessels. And in your body, most of your critical organs for your functionality are nourished with those small and medium blood vessels. And when you have diabetes, those blood vessels, the walls can become damaged and you can have leakage of fluid, and it can cause disruption to those organs and those structures. So in your eye, that's one of the few places that you can look in without cutting anyone open or doing any extra machinery, but you can physically just look in and make sure those blood vessels are intact and they're healthy and there's no retinopathy or disease of the retina happening. And so if you have diabetes, you do need to have your eyes checked at least once a year and maybe sooner depending on the status of your condition. So this male, he came in for his type 1 diabetic eye exam, and I was happy to report to his parent that there was no diabetic retinopathy, and we could just see him back in 1 year. And I also gave him glasses to clear up his vision a little bit. Now his brother was in the waiting area and we took him in too. We said, well, you haven't had your eyes checked recently. Let's check out your eyes too. So he was fine. He had no complaint at all. And when I looked in the back of his eye, when I dilated his eye, I could see his optic nerve, which is this area right here in the center of the picture on the left. You can see that what used to be really distinct margins of a nerve is all swollen, and there's blockage of the blood vessels and there's beading and a little bit of leakage. This is a swollen optic nerve head. Remember, the optic nerve is the connecting cord between the eye and the brain. So if the top part or the end of the optic nerve is swollen, then that could be the result of some viral infection. It could be a swelling of the brain tissue. It could be a mass in the brain or a lesion that's causing a pushing of the nerve head. It could be idiopathic, which means we don't know why. It could be many things, but it's definitely not what we would expect to see in a healthy 6-year-old. So because I saw this swollen nerve head, I did refer him to our neurologist right away to get that checked out. The next patient I had was a 14-year-old female, and she came in because she had headaches and blurry vision. And so they had already gone to her primary care physician to check out the headaches. And the primary care physician said, well, you do have blurry vision and headaches, and often those things go hand in hand. So you should go see an eye doctor. And that's when she came to see me. And I checked her eyes with my retinoscope, and I saw that she really didn't need glasses. So what's going on? Remember how I talked about the autofocus feature of our eyes and how I checked the calibration of it to make sure that it's exactly accurate? That function in her eyes was out of calibration. So her vision is always kind of going in and out of focus. And you can imagine that that could make life pretty stressful and hard, where you're seeing the text on a page just going in and out, and not being able to focus on it. So glasses would not help her. What she really needs is vision therapy to help her recalibrate her system so she can use her eyes efficiently and effectively. So we call that accommodative spasm, and I referred her out for vision therapy. The next patient was a 6-year-old female, and she came in because her eyes hurt. And usually when a child complains of something hurting and they're able to articulate exactly what hurts and when it hurts and why and how much it hurts, that's when you know there's something pretty serious going on. Often children won't report exactly how they're feeling when they might have something pretty major going on. So when this little girl came in saying that her eyes hurt, I had to see what was going on. What I did is I looked at her eyelids, and you can see her eyelid here. This is your upper eyelid, and it's inverted, so it's flipped inside out. And you may have done this when you were a little kid, when you were messing with your eyes. Some people could never dream of doing this to themselves, but it does not hurt to evert the eyelid. But you can see that it's nice and bumpy. And imagine your eyelid is like a windshield wiper going across your cornea and smoothing over your tears. And so if you had a windshield wiper, you would want that to be nice and smooth, because that's going to create a nice clear image for you. This little girl, her eyelid was so bumpy, I could see how badly it hurt. It's bumpy because of allergies. Right now in Southern California, we're in our spring season, and the pollen and the environmental allergens are definitely rampant with our pediatric patients. So she had a serious case of eye allergies to just environmental stimuli. And because it was so bumpy and so bad, I had to prescribe her a steroid eye drop. So this eye drop, excuse me, she had to put in her eyes 4 times a day, every single day. And then I had to see her back again to make sure that those bumps are flattening out. And eventually they need to be gone so she can see clearly and her eyes do not hurt anymore. I was able to see her back just yesterday before this presentation, and her eyes are already way better looking. The bumps are almost gone. There's still a little bit of bumps going on. So I've actually tapered her steroid eye drop down just a little bit. Excuse me. The next case that I saw was a 6-year-old female, and she came in because she lost her glasses and her vision was pretty blurry. And so this was a fun exam because she had no other conditions going on. She just needed new glasses, and I was so happy to help her get those new glasses. And then the next case was a 14-year-old male. He came in because he had blurry vision, and I noticed that his glasses were a little scratched up. And so his prescription did not change much, but he did have a little bit of a tear in the back of his eye, a retinal tear. Remember that your retina is the tissue that transmits the light energy from the world and your visual stimuli into the electrical signals to the back of your brain. So if that retina is torn and it's not nourished, then that retina can die and then you can go blind. Because that's such a serious risk, this patient was urgently sent to Retina, to our retinal specialist. We call it Center Retina, but it's ophthalmologists, so surgeons, they're medical doctors that then go on to ophthalmology residency, and they spend many years training in their specialty. So I sent him to a medical doctor who is a specialist in this specific tissue so they could repair that tear so the patient will not go blind. And that's my day. That was a great day that I had. I felt like I saw a lot of 6-year-olds that day, and I had a great time seeing them and helping them out. And that's what my average day looks like. So hopefully you're able to walk with me through that schedule and pretend that you're shadowing me in that and seeing what types of patients I see and what I do. So if any of this sounds interesting to you, or you want to learn more about it, there's amazing resources out there on the internet about becoming an optometrist. Now, the resources that I thought were the most helpful and the most informational, I listed right here. So I have the hyperlink here, but I also typed out what it is so you can screenshot and take this down for yourself. But the best website I saw was this one called futureeyedoc.org. And this is part of ASCO, which is the second website. ASCO is the accreditation body for optometrists and optometry schools, I mean. So ASCO is who basically says that an optometry school is proficient in producing doctors of optometry. Now, each state that has, if you're licensed to practice in a state, each state has their own laws about what an optometrist can and cannot do. But each school will teach you to be an optometrist for the highest level of practice. So you might remember earlier, I talked about how optometrists can do minor surgical procedures. I don't currently do that in the state of California, although in Oklahoma, that is something that optometrists do. So if you're interested in doing something more along those lines, then it might be helpful for you to look ahead and see what states that is available in. Regardless of what state you want to practice in, any optometry school will train you to that level, even if the state you practice in does not allow it. I hope that made sense. So we have futureeyedoc.org. We also have optometriceducation.org. And these are great resources for future students. And then we also have what is a doctor of optometry? And that's through the American Optometric Association. Also, I have never found an optometrist I didn't love. So they're all super friendly. I'll make that generalization on behalf of all of us. So they're all super friendly, and I'm sure any local optometrist would love to have you shadow them if you reached out and told them that you were considering a career in optometry. And then pre-optometry clubs are in many universities. And if your university doesn't have one, then again, this pre-health shadowing experience I think is wonderful. I know they have other optometrists on the pre-health shadowing portal. So if you do want to look around at some other optometry presentations that maybe are not pediatrics, go for it. This map in the background, if you haven't figured it out, these are where all the other schools are. And then there's one in Puerto Rico. Okay, so here's my contact information if you would like to reach out to me, ask me any more questions. But I'd like to leave you with this last optical illusion just to really drive home how much of your vision is just perception by your brain. Believe it or not, square A and square B are the same color. I did the ink dropper to color in this circle, and I did the ink dropper to color in this circle here. And I showed my husband this, and he said, I still don't believe you. So last night I put in this little slide graph to show you that it really is the same color, square A and square B. Here we go. There you have it. So your brain, it does a lot more for you than we give it credit. So it was a pleasure talking with you all. And this is the time where you can ask me any questions that you would like.
Thank you so much for that wonderful presentation. I could see why you are a pediatric optometrist, because like you're just so fun and just so comforting to listen to you. And like towards the end, I was wondering if my glasses were really working, because I was like, huh, A and B do not look the same, but yeah. And so yeah, thank you so much.
I know.
Okay, and so like we do have a lot of questions from the audience, so we can get going.
Okay.
So the first question in the chat was from Yulia, and so she was wondering how sensory fusion is measured during the ocular sensory motor exam.
Great question. So what we do is we have 3 levels of fusion, and we first start with our 3rd level, which is 3-dimensional vision. If you have 3-dimensional vision, then you inherently have the more rudimentary levels. And so we use this with something called a random dot stereo test. And we have a patient put on polarized glasses, and they look at those TV static-like screens, and then they report back what shape they see out of it. And so that's one way that we do it. And then the secondary level, so not everyone can get 3D vision for one reason or another, but the secondary level is we put on filters over your eyes, a red filter and a green filter, and we show you some lights. And depending on how your brain puts it together, you might see 2 lights, you might see 3 lights, you might see 4 lights, or you might see 5 lights. And I'll leave it at that because it's kind of important that you don't know how many lights you're supposed to see. So in case you have to get that done.
Thank you for that detailed answer. So throughout your presentation, you were mentioning some procedures that ophthalmologists do on their patients. And Bookbee was wondering, what are some minor surgical procedures that optometrists can perform if they can perform some?
Great question. So some procedures that optometrists perform and that I've done is there's something called a lacrimal irrigation, where you can, it's putting a needle through the tear duct and just flushing it out. So that's one type of procedure. Another one is if the pressure in your eye is super high, then we can slice into, these kind of sound a little much if you're not into this, but you can slice into the eye to relieve some of that pressure quickly. There's also some lesion removal procedures where you can use a scalpel to remove bumps and lumps from around and on the eyelid. And then finally, if you have something called a hordeolum or a chalazion, otherwise known as a chalazion, there's several different pronunciations. you can remove those in an anesthetic induced procedure as well.
Thank you for that. And
Yeah.
so another audience member, Katie, has asked, what made you decide that you wanted to work with kids as opposed to other populations?
So this is a great question because I love all parts of optometry. Throughout optometry school, every class I took, I was thinking, this is so cool. It was a lot, but it was so cool. And so when I was thinking that I wanted to specialize, I really wanted to do something that had to go back to optical illusions and that sensory fusion, and really working with that and making an impact that could affect someone's life for a long time. And that's where I found myself in pediatrics, because in pediatrics, it's almost a misnomer because I do see adults who have binocular vision conditions as well. But it's really working with the eyes and how they work together rather than glasses, cataracts, and ocular disease, which is all super interesting as well. So it's just where I am. Who knows if I'll forever be pediatrics? Maybe I'll branch out. I don't know, but I just realized this is recorded, so maybe I don't mean that. So that's okay. So that's what I'm thinking about. I just really love the energy that the kids bring. I love how interactive they are. And I like that I can really make an impact on their learning and their ability to go about their lives without any obstacles in their way as far as vision goes.
It seems like a lot of our audience members are interested in pediatrics as well. Ada asks, what advice would you give to students like herself who are interested in pediatric care and just how to deal with a younger population?
That's a great question. I'm not sure that I have the best answer because I feel like a lot of it is the parents of these kids really know them the best. And so I do take a lot of clues or hints on how to work with a patient from the parents. So especially if we have someone who is diagnosed with autism, they might be focusing on a specific area of their communication that month. And so I'll really rely on the parents to help me see if we can communicate a little more effectively with that patient. So I rely a lot on the parents. I like to have fun. I think that's the biggest thing, is I have a lot of fun with the kids. And then I'm never sarcastic with kids. So I will always tell them exactly what I'm doing. I won't joke around with them in a way that they can't understand. And I'm always at their physical level. So I do a lot of squatting throughout my day to make sure that they see that I'm a trusting figure in their life. And I never lie to a kid either. So if someone asks, are you gonna put drops in my eyes? I'll say yes. I won't say no and then do it, because that just destroys that connection. So hopefully some of those tips help, but it's really just shadow others in your field. If you're going to be in pediatrics, you're usually going to go through the core that then gets specialized. So throughout that core learning, whether it's in medical school, dental, optometry, PA, whatever it is, you have to go through the core first before you move on to pediatrics. And so in that core, you can look out for what your different attendings do with children and just pick up tips like that too.
And so it seems to me that clear communication is really important with kids.
Yes.
Yeah. Okay. And so people have been paying attention to your presentation, and the topic of tears in the eyes have been really intriguing to the audience. And so they have been asking, how does a retinal tear occur in the first place, and what other common types of tears can occur in the eyes?
Great question. So retinal tears are fairly infrequent, but they do happen enough that I check for them on every single person. If you are nearsighted or you need glasses to see far away, then you are at higher risk of having a retinal detachment or a tear. The tissue in your eye is very thin. It's like tissue paper, basically. And so when you are nearsighted, what happens is your eye, let's think of it like the little circle ball here. So as you're nearsighted, your eye is actually longer than a typical eye. So as your eye grows and stretches, that retinal tissue doesn't grow and stretch with you that much. So as that happens, that tissue gets weaker and weaker and weaker. So you could have that happen where it just finally snaps, not snaps, but finally tears a little bit one day. This can happen randomly. You can have trauma. So something could hit your eye and it could cause a tear in it. You could have different diseases can cause thinning of the retina as well. And then you could have something else around your eye be pressing in and it could cause a rip as well. So those tears, most of the time, you will know about it because you'll notice that your vision becomes different. So it can be different in that you could see all of a sudden a curtain over your vision, or you could see haze coming up from your vision, and it's only in one eye and it stays. So it doesn't go away and come back. It's something is definitely wrong. So I guess public service announcement, if you ever notice that in yourself or in someone else, they need to get to an eye doctor as soon as possible. And if there's not one around, then it's worth going to the emergency room. And so that's what a tear is. And they can repair it if you get there quick enough. And what they do to repair it is they can tack it back on to the tissue so it can get nourishment again. And they do that with a laser. And so they just tack it up with a laser. So that's the retinal tears. If you want to learn more, you can type into Google retinal detachment, and that can give you a lot more information.
Thank you. So relating to that answer, an audience member asked if someone is farsighted or nearsighted, can their eyes ever get better? Like better meaning they don't have to use contact lenses or glasses anymore. Will their eyes ever like heal?
Short answer is no. There's a small lucky prescription that you can have where all of a sudden it works, but that's 1 in a million. And if you're farsighted, which means that you need glasses to help you up close, there is a period of time between about like 12 years old and 20 years old when you can grow out of those glasses. But yeah, usually whatever your eye is, it's going to stay like that in needing correction. That correction can come from contact lenses, it can come from spectacle lenses, it can come from surgery, like a LASIK type surgery or something like that, but usually not.
Very awesome. And so another audience has asked, what is one thing that you wish you knew before you started optometry?
Okay, like I said, I do not wear glasses or contact lenses. I wish I knew that optometrists fit contact lenses. And I know that sounds pretty silly, but I had no idea until I was sitting in contact lens class and I realized that there was a whole world out there that I didn't know about. So that was one thing I definitely wish I knew about what I had to become trained in, is that we do get trained for a full scope of practice, even though I mostly practice pediatrics and I do fit contact lenses on kids, but I didn't realize that that was part of what I did. And I also didn't realize that it's different per which state you work in. So I'm licensed to practice in California, but I went to school in Michigan. And so in Michigan, what I was licensed to do there was much different than what I can do in California. California is a little bit more limiting. So I cannot prescribe oral steroids for kids for longer than a certain amount of days. There's lots of little laws like that that you have to keep track of depending on what state you practice in.
Awesome. So relating to the pandemic, with COVID here, many kids and adolescents have turned to technology, and people doing schoolwork like read a lot with their books with the majority of the day. So are there ways we can protect our eyesight?
Yes, I'm so glad that you asked this, because I was thinking of how can I incorporate this piece of advice into my presentation. Really, the best thing that you can do is give your eyes a break. So your eyes are used to moving around, especially in a classroom setting. You know, you look at your professor, you look back at your notes, you look across to your friend, you're always moving your eyes, and that keeps them flexible. When you are sitting in a room and looking at your computer screen and just totally tuned in, that's when you can get some computer vision syndrome or eye strain. And what you can do to prevent that is called the 20-20-20 rule. The 20-20-20 rule is every 20 minutes, take 20 seconds to look 20 feet away or farther. And that's just to force your eyes to relax and get out of that locked in position. So that's the best thing, is to promote good visual hygiene. You can also, whenever you're looking at a device, it's helpful to have room lights on around you, just to give yourself an even viewing field. Having good ergonomics, so sitting with a good posture, feet flat on the floor, sitting about 16 inches or farther from your computer monitor is helpful. A lot of people ask about blue light glasses, and I will tell you that the studies really do not support blue light glasses as being more effective than placebo glasses. Placebo, keep in mind, can be a treatment in and of itself. So if you have blue light glasses and you swear by them, keep doing it. And if you are thinking of dropping some money on getting some blue light glasses, I'll let you know that it probably won't change much for you. So that's my little thing about blue light glasses too.
And so I see some future optometrists in the audience. I think you've persuaded some people to go into the field. And so Ziad has asked, have you dealt with corneal abrasions or maybe Bohemian gland dysfunction?
Yes.
He's on the right track.
You got it.
Is this something an optometrist can treat themselves?
Absolutely. So corneal abrasions, remember the cornea is the frontmost tissue of your eye. It's a clear circle, basically, that is the front part of your eye. And things can hit it. Things can cut it. Things can get into it. I've pulled a bug out of a cornea before. And so basically what you do as an optometrist is you identify what it is on the eye, and you determine if it has totally punctured the eyeball. If it's totally punctured, I will not treat it. I will immediately send you to the emergency room so they can surgically correct it, because that's pretty serious. Your eye is filled with fluid and it has to maintain a specific pressure in order for the nerve and the cells to work properly. So if something has punctured the eye, then I cannot do that. You have to go to a surgeon. But if something is embedded in your eye and it's not punctured, which it's very, very, very hard to puncture your eye. But if something is embedded, then yes, I have little drills and tools that I use to help get it out. And then I will treat you with an antibiotic and steroid combination. If the abrasion is in the center part of your vision, you might need a little bit of a heavier concentration or combination of medication to resolve the scarring and the tissue healing. So I will send you to a specialist, a corneal optometrist. So an optometrist who specialized in corneas. So just the front part of the eye, that's all that they do. And so like how I specialize in pediatrics, there are other optometrists who only work with corneas. So I would send them to that. My Bohemian gland dysfunction, I do treat that quite a lot. When I worked at the Veterans Affairs Hospital, I had to treat that quite a lot as well. That's not as exciting though as the corneal abrasions.
Jalen wants to know the difference between an ophthalmologist and optometrist, and specifically your decision of why did you want to go to the OD route instead of the MD route?
Excellent question. I think that's perfectly appropriate for this specific setting of pre-health shadowing. An ophthalmologist is a medical doctor who, after undergrad, they went to medical school. And then in medical school, you get matched to a residency for your specialization. And so medical school, of course, is 4 years. And then your residency, if you go into ophthalmology, is 8 years, or 7 or 8 years, I believe. So it's a long time. And so you go through all of undergrad, no eyes. You go through medical school, no eyes. And then you finally get to your residency if you get matched. I knew I wanted to do eyes from the day I watched that darn movie. So I wanted to go straight into it, basically. So I thought about going back to medical school to become a surgeon and an optometrist, but I just love what I do, and I would not want to, I really don't want to do surgery. So that was pretty easy after the fact, but it was a consideration with how much time it takes to become an ophthalmologist, and then how soon you can dive into the eye material. And I just wanted to get into it as soon as possible. In optometry school, remember, you just do your bachelor's degree and then optometry school. So those 4 years of undergraduate, I was just ready to go.
And so going along with that question, and this is the last question of the night, sadly, Mark has asked, do you necessarily have to get a bachelor's in biology or vision, or could it be any bachelor's of sciences in order to get into optometry school? And like any advice that you have in order to get there?
Yeah, great question. So not every school requires a bachelor's degree before entering the optometry school. Some schools offer a 3+4 program, or a program where you finish your bachelor's degree in optometry school. So you kind of do a double duty type of thing. And that's actually what I did, is I did a double duty where I finished my undergrad during my first year of optometry school. So you do not have to do your bachelor's degree in biology or vision or anything like that. You can do it in anything that you want, as long as you meet the prerequisites for the optometry school program specifically. Now, each optometry school has their own set of requirements. So it is important to look to see. So some schools I know required 2 years of anatomy with 2 anatomy labs, things like that. Other schools might have only required 1 anatomy lab. So look at the schools that you're interested in, make a list of all of the prereqs and see what overlaps and what you need. And if you are thinking, you know, this is no big deal to add on this extra class, so I can be available to apply to these 4 different schools maybe, then go for it and add on that class. But if it's going to be a big financial burden to maybe add on 3 or 4 different classes just to be able to apply to that school, I would reach out to that school and do a site visit and see if you could see yourself at that school before you make that huge change to your schedule. As far as advice about your undergraduate programs, I loved my liberal arts semester. I did science, and then I needed 3 liberal arts classes to fulfill from my prerequisites. And I just love that. And so I do wish that I took a few more liberal arts classes, because as you all know, in your pre-health, the biologies, the sciences, they can get pretty heavy. And the social sciences were just very fun to learn about. And I thought that they really helped me relate more to my patients, and the things that I learned in those classes were just great to also meet other people and maybe some non-science majors. My best friend was a non-science major, and she and I are still best friends, and she just does not understand what I do, but I like having that balance so I can kind of take a break sometimes.
Yeah, I definitely agree with that. The humanities is an amazing world on its own, and we should all be aware of that when we get a chance to. So thank you so much for your very informative presentation. We really enjoyed it, and I know the students here did as well. So we're going to move on to our wrap-up presentation. So I think we all learned a lot from our wonderful speaker, and we should take the time to reflect on what she was talking about. So some of the reflection questions PHS asks is, what brought you to the session today? What are 3 major takeaways you got, and what do you want to learn more about? This writing or reflection is not required. However, we encourage you to submit it to our website for publication for recognition of your hard work. I'll check it since I'm the editor-in-chief, and you can just keep it for documentation for future applications or just looking back on what you learned. So if you want to learn more about pre-health shadowing and get involved in our program, we encourage you to visit our website. You can become an asynchronous volunteer to get certified hours through professional nominations, graphic design, social media promotion, and grant writing. We are also active role in PHS to lead projects and initiatives and be co-hosts like us up here. Financially able to donate because of running through Venmo or PayPal. If you are someone who cannot afford it, or you can send it to someone who can, and support the organization by giving free access to programs like this to other people. Otherwise, we also ask you to spread the word about pre-health shadowing so as many students as possible can attend these sessions. Now for the part we've all been waiting for, earning a digital certificate for the virtual shadowing hours from the session today. So first, you will be going onto our website and finding our professionals course page by typing in their name. Next, you can take our quick 10-question multiple choice quiz based on the content from the session today. You will have 30 minutes per attempt to earn 70% or higher to get your certificate. We know that sometimes technology can be difficult, so for this reason, we do allow everyone to have 2 attempts to take the assessment. But if you do run into any difficulties and your quiz doesn't pop up, please contact us at info@prehealthshadowing.com and we'll try to fix it for you. To ensure that our website does not crash from a high influx of students coming in, we recommend waiting 30 minutes to an hour after the session to take the quiz, which will be open indefinitely. So you can take the quiz a month from now if you would like. And we do have our sessions recorded on YouTube if you want to go back. Once you have passed, you can click the Finish Course button at the bottom of the professionals page, and you can download your certificate for your own personal records. If you missed a part of the session or want to go back and view other sessions that we have from wonderful health professionals like the one we had today, you can go onto our YouTube page and view our previous recordings. You can also find them via the professional pages on our website, and you can take post-shadowing assessments on all of the ones on our YouTube page and our website. So be sure to follow us on social media or subscribe to our email list for the latest updates on upcoming sessions and events that we have. We are currently booked every weekday through until June for virtual shadowing sessions. So I hope to see you guys there in our future sessions. Thank you for joining us today, and please stick around if you have any questions for myself or other team members, and we will be happy to answer them. This shadowing session is officially over, and I invite you all to log off. Have a wonderful evening or day, wherever you are. Thank you, guys.